Hey guys, welcome back to my channel, or welcome if you're new. My name's Emma. I'm currently pregnant. I'm 24 weeks pregnant with my first pregnancy. I'm having a girl. Her name is Sage. If this is your first video that you're seeing of me, I would suggest that you click off and go watch something else. This video is going to be a little bit different than the other ones that I have filmed and posted before this one. This one is a bit more somber and emotional, and I almost just feel like I shouldn't even post this, but the whole reason that I am making videos and posting them and everything is because I want to be able to look back on my experience and remember how I felt and every single thing that I'm going through, because I know that you just forget, and I don't know that I will ever want to rewatch this video. I'm gonna try to just talk, get this out so that I don't really have to edit the footage, and then I can just post it. I don't know that I'll ever really want to rewatch this video, but the main reason that I'm posting it as well, besides because I just want to document everything, is because I have just been looking for a bunch of videos like this, and there are not that many out there, and for me, watching other people's experiences and everything just makes me feel, I don't know if comforted is the word, but just like I know what to expect, or like somebody else is going through the same thing. So I'm hoping that will be this, or this will be that for some of you out there. So like I said, I'm 24 weeks, and I'm basically, my last update was from 18 week, or like my 18-week update. I'm kind of going to skip the period from 18 to 20 weeks. The only like real significant thing that happened during that time is around 18 weeks I started feeling the baby move, and over that period of time she started moving a lot more, and that's really the only thing that happened between 18 and 20 weeks. When I turned 20 weeks on that day, so basically I'm just going to talk about the last 4 weeks between 20 and 24 weeks, because a lot has happened, and I've already been filming for a couple minutes, and this is probably going to be a really long video, so I'm just going to try and talk. I just got a very nice call from my sister, so I'm jumping back in. I think I was saying that I'm just going to try and talk through everything, you know, as quickly and concisely as possible, while, you know, making sure to mention all the details. That's redundant. That doesn't make sense, but okay. So at 20 weeks on that day, I went for my anatomy scan, and so they would tell us the gender, because we planned a gender reveal for the next week. And at that scan, obviously we found out that, well, they didn't tell us, but they wrote it down. But we found out the gender that day, and then after the scan, I kind of was suspicious that something was wrong, because, what did she say? The ultrasound tech said, like, your nurse practitioner, or like, because I was seeing the nurse practitioner that day instead of the doctor, she was like, she'll go through everything with you. And I'm a nurse myself, and I just, that really kind of like triggered my mind, because whenever I have patients that go for, you know, a CT scan or an MRI or whatever, and I can see the results, if it's all good, then I'll probably say, your CT looked great, or your MRI looked great. But if the result is bad, then obviously I can't be the one to convey that message. And so I'll say, you know, your doctor will go over the results with you. And so whenever she didn't say, like, everything looks good. And she said, you know, that she would go over it with me. That just kind of like in my mind was like, okay, there's something wrong that she can't tell us. Hayden could come in to just the ultrasound with me, but he couldn't come to like back into the exam room with me. So after the ultrasound, they made him actually leave like the whole office. So he left, and I went back into the office, and the nurse practitioner told me that they were going to be referring me to a maternal fetal medicine doctor, or I don't know if they're called that, or a perinatologist, or a high-risk doctor, I don't know, another specialist, because they saw a cyst-like structure on the brain. That was the words she used. And they believed that they saw a 2-vessel cord or a single umbilical artery. They can be called either one of those. And she said, we believe that we see that, but with our ultrasound, we can't definitively say that it's a 2-vessel cord. So we're going to just refer you to somebody else, and they will either be able to confirm or say that it's not a 2-vessel cord, and just take a closer look at everything. And she just was very reassuring, although obviously I was freaked out. She's very reassuring, you know, that just anytime we see something, we always refer just to be safe. You know, these are both things that have usually normal outcomes, and, you know, she was very nice and everything about it. This was the first time that I recognized the chance for trisomy 18, because I just Googled like cyst-like structure on the brain, and the first thing that comes up is choroid plexus cyst, which is actually like somewhat common, and usually they resolve by 28 weeks. But whenever I was reading up on that, it says, you know, a lot of times people can be concerned about that because in cases of trisomy 18, like a third of the cases or more or something, I'm not sure how many, have choroid plexus cysts. So there's just like a little bit of a correlation between the two. But I didn't think, because she said that the heart looked great and she didn't mention anything else anatomically that was wrong. So even though I knew that those two things are kind of associated, I wasn't thinking like, oh, well, it must be trisomy 18 because, you know, she has a choroid plexus cyst. So a couple weeks went by, and I went and saw the maternal fetal medicine doctor, and I had an ultrasound with them, and again they said the heart, you know, looks great, except, well, they confirmed the 2-vessel cord. They said she definitely does have a 2-vessel cord. They said if she had a cyst, it already resolved, which I was like, oh, that's great news. That was like a big weight off of my chest. But so the cyst resolved, but they confirmed the 2-vessel cord, and she said that she was in the 8th to 9th percentile for her size / weight. They predict the weight based on the size. And they said that her pulmonary artery looked bigger than they expected it to. She said the actual heart itself looks good, but the pulmonary artery, which carries blood to the lungs from the heart, not necessarily while they're in utero, because they don't really have to do that, but obviously, like on an adult like myself, my pulmonary artery carries it to my lungs. So she said that looks bigger than we expect it to. So 2 things: we want to refer you to a pediatric cardiologist to get a fetal echo to look at her heart in more detail, and also we want to do genetic testing. We want to do carrier screening on you, just because there's now, we see like a cluster of symptoms that make us more suspicious that there's a genetic problem between the 2-vessel cord, the growth restriction, and potentially something with her heart. We just want to, do the genetic testing. So on that day, that was June 9th, I was almost 22 weeks that day. I was 21 and 5 that day. They drew blood. We did the NIPT, basically. She said I could do that, or I could just go ahead and do an amnio, because obviously an amnio is comprehensive and definitive, but I didn't want to do that. I said, let's do the NIPT first, which is non-invasive. They just get like some of the baby's DNA that's circulating in my blood. So it's just a screening test. It's not a diagnostic test. It screens for trisomy 13, 18, and 21, and then some like micro deletion things in the DNA. So we did that day. That was on a Tuesday. So yesterday, which was a Thursday, 2 weeks and 2 days after, yesterday was June 25th, I got the lab results back, as well as had my fetal echo, and that is where this becomes very fresh and emotional for me. So I think last night I feel like I cried everything I have to cry, and I have talked through it with relaying the information to my parents, and I had to relay all the information to Hayden too, because he wasn't there. He wasn't allowed to be with me, so I had to tell him, I had to tell my parents, I had to tell his parents. So I've talked through it a few times, so hopefully I'll be able to get through this without getting emotional. If I do, I'm not sorry. I mean, it's emotional. So basically they called, my appointment was at 1 for the fetal echo, and she called while I was registering at the hospital for the fetal echo. At 12:45, she calls me with the lab results, and she didn't say anything about the carrier screening. I'm assuming that came back fine because she didn't say anything about it. Or maybe they don't have the results yet of that, I don't know. But the NIPT genetic screening came back and said that the baby is it shows an increased or high risk or whatever for trisomy 18, which, if you don't know what trisomy 18 is, you can Google it. It's basically where there's an extra copy of the 18th chromosome, and it's fairly uncommon, I think, from what I've read. It occurs in about 1 out of 6 to 8,000 pregnancies. The frequency of actual birth is lower, or I guess, yeah. It's lower because, or maybe it's vice versa, it occurs in 1 out of 5,000 pregnancies, and births is 1 out of 6 to 8,000. And the reason for that is because some people choose not to continue the pregnancy if they find that out, and a lot of babies don't survive the pregnancy. They pass in either the 2nd or 3rd trimester. So it is a pretty severe and serious genetic abnormality. Like I said, a lot of them don't survive the pregnancy. If they do, it might be hours, it might be days, it might be months, it might be a year. There are some cases where they are able to actually grow and get older. I watched a video where they have a 6-year-old with trisomy 18, but that's pretty rare. So obviously, that was really upsetting news to get. And she said basically, she said just based on this screening, it looks like about, at least if I remember right, this is what she said, that it looks like about a 4% chance that this is actually the case. Which whenever you say 4% chance, you're like, oh, well, there's a 96% chance that that's not the case, which is great. But whenever it's normally 1 out of thousands and thousands, and all of a sudden you are 4 out of 100, and that paired with some ultrasound findings, which I'm about to get into the echo, but that paired with some other things, it makes you feel like, you know, I want to have hope, but I also am like, but why would she be having these other ultrasound findings and stuff if that wasn't the case? If all of her ultrasound findings were completely normal, then I feel like I would feel a lot more like, okay, like she screened that there's a chance, but you know, it's not the case in our situation. But I'm gonna get into the echo now. They did the echo. It took about like 45 minutes, maybe less, 35, 45 minutes, somewhere in there. And then they talked to me afterwards. And I just want to say that all of the doctors and nurses that I've encountered during this time have been so amazing. I've seen some stories where they really just like, you know, made them feel very like discounted, and you know, like the pregnancy just doesn't matter anymore if it's trisomy 18, and like, you know, don't waste your time, don't waste your resources if that's the case. Nobody has made me feel like that. Everybody has made me feel like we're gonna do everything we can, which obviously we haven't had a diagnosis, but everybody has just been really kind and really sweet. And she actually did, after talking to me, because she knew I was there for my echo, she called the cardiologist office and relayed that I had just gotten that information because I was pretty emotional. And so she knew that we had just received that information. So she was very like, you know, are you okay? Do you want to do this now? Do you want to wait a few days? She's very, very nice about it. But I chose to just go ahead and do the echo. I was already there. And I had been waiting on it for a few weeks at that point, so I just wanted to go ahead and get it done. But so she did the echo, and her heart is just messed up. I don't know how else to describe it. At both of the other ultrasounds, the anatomy scan and the one where they were able to confirm the 2-vessel cord, they both said her heart looks great, there's 4 chambers, it's circulating right. But in this fetal echo, she said there are a few things. Number 1, she has a ventricular septal defect, which I'm not going to worry about editing this video to put graphics in or anything like that. If you need more information, just Google it. A ventricular septal defect is just like a hole between the 2 ventricles of the heart. The right ventricle usually gets unoxygenated blood from the body, and then after going to the lungs, then the left ventricle gets oxygenated blood and pumps it through the aorta out to the body. So that's normal circulation for a normal adult human, or just like living human. Fetal circulation is a little bit different, but basically there's a hole between those 2 ventricles, and so the blood kind of mixes the unoxygenated and the oxygenated blood, and she also has coarctation of the aorta, or a nearly interrupted aortic arch. So it's not actually interrupted. There's just a segment where the arch becomes the aortic arch. If you picture a heart, that big thing over the top that carries blood out to the whole body, it's like thick on both sides, and then in the middle there's a very small segment. They gave us some little graphics. I'll see if I can show you guys a picture on here, but basically there's a segment of it that's very narrow, and then in addition to this stuff, the aortic valve, which is between the aorta and the left ventricle, is very narrow. Where is this graphic? So basically, I guess you can kind of, see in this one. So this part should all be connected, but there's just this very narrow portion in between. So this is like what a normal heart looks like, where it's just one big arch, and hers in the middle, there's just a very narrow portion. So yeah, anyways, she basically told us that these heart defects are something that will definitely need surgery before she can leave the hospital. So that means as soon as she's born. Like I said, fetal circulation is a little bit different. So there are a couple little like bypass structures because the blood doesn't have to go to the lungs. So she said that basically I'm sorry, I'm getting so like distracted while I'm saying this because I'm looking through all this stuff, but basically right now there's not a lot of like issue with her circulation because she has what's called a patent ductus arteriosus, and there's something else I can't remember, but basically these mean while she's in utero there's not a lot of problems with her circulation, but once they're born those little bypass structures close up, you know, within a couple of days. So as soon as she's born, they're gonna have to take her to the NICU and start giving her medication to keep those structures open so that she can keep circulating until they take her for surgery and fix those issues to widen the aortic arch, like the aorta, and to patch the ventricular septal defect. And she said if the aortic valve continues to grow with the rest of the heart as she gets bigger, then that won't need any surgery or like fixing. But sometimes just functionally, because it's not doing a whole lot right now because there is the defect in the ventricles and the blood can also go through the kind of bypass structures. She said sometimes functionally it just kind of stops growing, and so then in comparison to the rest of the heart it's smaller than it is even now. And she said if that's the case then it becomes a little bit more complicated and serious of a surgery because they will actually switch the pulmonic valve and the aortic valve, so they can use the normal size pulmonic valve in place of the aortic valve. And they'll use the smaller valve as the pulmonic valve. And basically what this will do is just make sure that there's no problem with getting blood flow out to the body. So I kind of skipped over that I scheduled an amniocentesis for this coming Tuesday at 8:45 a.m. So I got all that information yesterday, June 25th. Today's June 26th. And my amnio is going to be on June 30th. So that is what will definitively tell us if she has trisomy 18 or not. And like I said, I'm really trying to be hopeful. I'm definitely not hopeless. But just knowing between her having very small size or like growth restriction, as well as a 2-vessel cord, as well as heart defects. Those things do kind of point in the direction of there being a genetic issue. There are a lot of things that are associated with trisomy 18 that she doesn't have, or that haven't been relayed to us. If she does have it, they haven't mentioned any other, you know, her spine looks great, her kidneys look great. Sometimes in trisomy 18, their actual like intestines and everything, their abdominal organs can grow like into their umbilical cord or outside of their abdomen. She doesn't have that. She doesn't, other than when she did have the cyst, which has now resolved. Her brain is fine. One thing with trisomy 18 that's very indicative is if they have clenched fists, and she moves around a ton. And all of the ultrasounds and stuff and the echo yesterday that I've had, they have remarked how she's just moves so much. So we haven't really been able to get a good look at her hands. So that's kind of a question mark in my mind that I wish I knew if she had that or not. We could definitely see like her doing thumbs up, and like these fingers, we could see them out. But we couldn't see, like, we didn't get a good shot of like her hand fully open, and she just kept moving around so much that we couldn't get like a really good shot of her hands at the ultrasound. So I don't know if her having these fingers open counts as like not clenched fists, or if it's still considered clenched fists if she was going like this. So I really don't know about that. But you know, despite there being a lot of things that she hasn't displayed, there definitely are ultrasound findings that are indicative of trisomy 18. So I'm really just trying to be optimistic and hopeful, but also just be mentally prepared for anything now. I never anticipated any of this. And it's crazy because she is so active and she just kicks me all the time, and in my mind I'm just like, she's happy and she's healthy and there's nothing wrong, and then you get all this information to say otherwise, and it's just very weird. And so yeah, basically you know, that's kind of the boat that I'm in now, and she, I guess we're gonna find out in the next few weeks. I don't know how long the results of the amnio will take. I don't know if it will take a few days or a few weeks or what, but yeah, that is my 24-week update. I'm gonna just stop the video here. If you're going through the same thing, I hear you, I see you, you're not alone. I know that this is just literally the worst. Like, it just sucks, especially if you're going through this during COVID, because you have to go into all your appointments alone. So I just want you to know, if you are also going through this and you're watching this video because you're experiencing the same thing, I just want you to know that you're not alone, and no matter what the case is, you know, you can get through this. I'm gonna get through this, even if it's the worst thing to ever happen to me in my life. We just have to be strong, because our babies need us to be strong for them. And I just feel compelled also to say that my faith is very important to me. I am a Christian, and that is a huge part of my life. And I just want to say that this is one of those things that very hard to wrap your mind around. And so if you're also a Christian and this is kind of making you struggle, I hear you and I understand you. For me personally, my faith has been the only source of comfort in this, that and knowing that our family, both of our families are in it with us and, you know, along for this journey with us and praying for us and everything. And this video is really long, so I'm gonna just try and wrap it up, but you know, I would just tell everybody to just remember that God is good all the time, and all the time God is good. And He is, if you're experiencing this, just know that our babies are in His hands, and even if we don't get to hold them and love on them and raise them, they're in really good hands, and they're gonna be with Him. And that's a big source of comfort for me, knowing that if I don't get to raise her and love her, that she's still gonna be loved and in a safe place. So yeah, I'm getting emotional now, so I'm just gonna wrap it up. Thank you for watching. As things continue, I'm gonna just update. So you know, if you're going through this as well, then just kind of, you know, stay tuned. I'll be posting what happens. And if you are a believer, please, please, please be praying with us and for us, because we really need it. So thanks. I'll see you guys at some point. I don't know if it'll be next week or a month from now, but at some point I will update. So that's gonna be it.